Hello, this is Professor John Argalaska. Most of you know me. I am making this short video, a few comments for my students of Psych Assessment, Psych 5080. Um, First of all, the very first question, I do have some notes off to the right on another monitor, so you'll see me glancing in that direction, um, and that's why I'm looking over there. The bottom line question is assessment valuable? I start off usually in my face-to-face classes with a debate about whether it's a good thing or not. Many students come into assessment with the idea that assessment is labeling people, and they have a lot of arguments against it, similar to the arguments against diagnosis. Is diagnosis helpful or hurtful? That's something that it can be debated from both sides. And certainly it's worth looking at both sides of the argument. So is assessment valuable? Well, I believe that it can be valuable. Can assessment do damage? Can it be misused? Most certainly. And unfortunately, there is a reputation of the early intelligence tests having been misused on students who were not represented in the normative sample. And I think you probably know that I'm referring to standardized intelligence tests that were normed on middle class socioeconomic status children, mainly from suburbs who were white middle class. And then these tests were actually administered to black inner city children with results showing that black inner city children do not score as well on intelligence tests as white middle class suburban children. And this was used by some people to demonstrate that black students were inferior as far as intelligence is concerned, which is absolutely ridiculous. Um, the bottom line is that assessments have to be properly used, and an assessment has to be chosen with reference to the appropriate culture for the individual that you're working with, for your client, and there has to be, they have to be represented in the normative sample. If you take a look at the Pearson's Assessments website, there are many standardized intelligence tests listed in there, and you can see that they have normative samples from various groups and various language groups as well. So the test can be given in some cases in French, German, English, Spanish, and oh, there is also a test that has no language involved in it. It's called the UNIT, and UNIT, and I'm afraid I don't remember exactly what that stands for, but it's a test that is completely done without language. It might be something you'd be interested in looking at. UNIT. So bottom line, make sure that your client is represented in the normative sample if you intend to compare their results to the broader group. Okay, so validity. Does a test measure what it says it measures? Not quite so obvious. There are several ways to determine that validity. Reliability simply means that the test, for instance, if given today and next week, would result in similar scores if there is no intervening maturation or other kind of circumstances, for instance, the individual getting sick. That's test-retest validity. You would expect that the second time a person takes a test of any sort, that they would do a little bit better because they have some familiarity with the format of the test. So, but one measure of reliability is test-retest reliability. Now, pre and post testing is not a way of measuring test-retest reliability. Some people have confused that. Pre-test gives you a baseline, say on symptom checklist 90, and then you go through 5 weeks of therapy and you do the symptom checklist 90 again, you're hoping that you're going to have some of those symptoms somewhat ameliorated. So test retest is not the same as pre and post. Pre and post is used as a measure of whether the intervening strategies have been effective or not. Or it could also be a measure of maturation. Um, Validity doesn't measure what it says it measures. Reliability, will it give the same results if performed by the same person under the same circumstances in a couple of weeks or in a month? Inter-rater reliability, if I give the test or another rater offers the test to a group of students, will the results be the same? Now, this isn't as obvious as it seems. It has been demonstrated. I'm afraid I don't have a reference for you, which you should hold my feet to the fire for that. Um, but students who are members of an ethnic subgroup who take a test from someone who is representative of the dominant culture don't do as well in taking that test as when the rater, even though they do exactly everything the same, um, is a member of their own culture. So that's a rather interesting sort of a thing that somehow students in their performance do better when they see a moderator or someone who is in charge of giving the test is a member of their same cultural group. So not so obvious with inter-rater. However, if a test is well designed, I should be able to give it to a group and someone else should be able to give it to a group, and the results would not vary between raters as long as we use the standardized procedures. That's so test retest, inter-rater reliability. There is also a thing called split half or internal reliability. That means that each of the questions in the test actually contributes and agrees with the overall result. A split half reliability is often referred to as coefficient alpha, and that is a reliability coefficient. Generally speaking, greater than 0.7 is sufficient. The test coefficient alpha is done with a computer-generated analysis that takes every possible split half of a test and compares it to every other possible split half. One half of a test should agree with the other half, and that's called internal reliability. So you have test-retest reliability, inter-rater reliability, and internal reliability. Now, there is something added to psychometric qualities that you did not have with reliability and reliability in research methods, and that is clinical utility. Sometimes a test will be valid and reliable, but it's not worth the paper it's printed on in terms of giving you a pathway for repairing or enhancing whatever is going on with your client. And vice versa. Sometimes you have no validity and reliability, and yet you have good clinical utility. An example of that is something like the Rorschach. The Rorschach has very little validity in whatever measure you choose to look at. There are some attempts to make the Rorschach a more valid instrument. It doesn't have reliability, test-retest reliability, nor inter-rater reliability, and there certainly is no such thing as split-half reliability in the Rorschach. However, it can tell you all kinds of things about your client that will give you information that can help you to determine what procedures you should use in therapy. The Rorschach, by the way, is not interpreted by the choice of things that a person reports seeing. For instance, I see two scorpions fighting with each other. That's rather irrelevant. what is looked at is the person looking at the whole test, the whole ink blot, or is he looking at just a part of the ink blot? Is he globally interpreting it or interpreting just pieces of it? Um, these kinds of things are looked at in scoring the Rorschach. There is a way to score the Rorschach called the Exner, EXNER scale, and if you're trained in that, it can be have quite a lot of clinical utility despite not having validity and reliability. So, three qualities in assessment: validity, reliability, and clinical utility. Um, the very first thing that you need to do when you're doing a formal assessment is to get informed consent. Discuss confidentiality. Let your client know that you may have to confer with qualified colleagues in the field regarding their results. So they should know what's going on there with confidentiality, who it's going to be shared with. You should ask them to get a release allowing you to see the records of other clinicians who have seen them previously. There are forms for releases of information that you can find on the internet. This is something you should do for every assessment if you're doing a formal assessment for sure. You should do a comprehensive review of existing records with those appropriate releases. Remember that anything you put into this person's file is likely to be read by other people. For instance, a school assessment, an academic assessment, is going to stay with that student for probably the length of their academic career. And parents have access to that. Be sure what you write is beneficial and does not harm an individual. So you have to be very careful about what you put in there because of the possibility of secondary audiences, and also because you want this to be of long-term benefit to your client. So be careful. Oh yeah, don't hesitate to request a vision and a hearing exam. I think I might have mentioned that earlier. Make sure your assessment is culturally appropriate. If you have some problems with interpreting the assessment, don't hesitate on conferring with supervisors or colleagues who have perhaps more experience with that assessment than you do. That's common, so please don't hesitate to do that. Remember, some assessments do require training. The Standardized Intelligence Test and also the Minnesota Multiphasic Personality Test do require some specialized training. Pearson's Assessments offers the webinars for training for free. Really a valuable resource that you may want to consider later on. And the bottom line for whether it's ethical for you to use an assessment or not is scope of confidence. Okay? Scope of confidence is the bottom line. If you know what you're doing, use that assessment. Okay. So I also wanted to mention that there's a split in assessments according to the nature of the tool. There are objective tests which have Likert scales, sometimes forced choices that make clients uncomfortable. Paper and pencil reports and standardized intelligence tests, achievement tests are all considered objective tests, and they yield scores that can be manipulated statistically according to the quality of the data that you have. You know about the levels of data: nominal, ordinal, interval, and ratio. So the data can be manipulated according to the level of data that you have. Those are objective tests. Now, they are one genre of assessment. Projective tests are a totally different sort of a thing, but they are a big part of clinical assessment. Projective tests such as the thematic apperception test that you've examined, also the Rorschach, which I mentioned briefly, the kinetic family drawing test. These are things wherein the client is asked to perform something, for instance, draw something, or to tell a story. The Rotter incomplete sentences battery can tell you a lot about your clients. These are referred to as performance or projective tests. Now, they have weak psychometric qualities in terms of validity and reliability, but can be very, very rich in terms of clinical utility. Psychometric qualities are not the be-all and end-all of assessment. Objective tests should have good validity, reliability, and clinical utility. Projective tests may lack validity and reliability, yet have a tremendous amount of clinical utility, and they're a good thing to have in your quiver, so to speak. Let's see. Well, you know, there are standardized tests that have large normative groups of different populations, allowing you to compare the results of different individuals who are representative of, who are members of ethnic subgroups, and they can be appropriately compared to appropriate norms. Standardized tests are really neat in terms of being able to put things in terms of numbers. Usually a standardized test has an average. It's designed to have an average of 100, usually a standard deviation of 15, which makes it very easy to interpret the results, because you know from the nature of the Gaussian distribution. Oh, Gaussian, what the heck is that? Normal distribution, Gaussian distribution, same thing. You know that there's approximately 34% of individuals in a normal distribution who fall between the mean and one standard deviation above, 34% fall between the mean and one standard deviation below. So standard deviation can give you quite a lot of information about how a client compares on the results of the measure that you've used if you have a standardized test that has this data for you. There are brief and narrow targeted inventories. Beck's is one of the classics. Beck's Depression Inventory, 21 questions. If you Google or if you go to YouTube and do a search for Ode to Beck's Depression Inventory, you'll find a 3-minute ditty, and a neat little song about Beck's Depression Inventory. And if you listen to that, you will probably forever remember a few items about Beck's Depression Inventory that may be of value to you. There are broad-based symptom inventories. Oh, another short one is the Hamilton's Depression Inventory. Beck's and Hamilton's also have an anxiety instrument as well. There are broad-based symptom inventories, such as the System Checklist 90. It's really nice. And there are inventories and assessments for all kinds of disorders, psychological problems. And you can find these listed in the Mental Measurements Yearbook, which is available through the database at Antioch. And you can also find an awful lot of information regarding assessments from Pearson's Assessments website. Good thing to check out. Let's see, there was something else I wanted to bring up to you that has slipped my mind for the moment. It's called the tip of the tongue phenomena, and it's right there on the tip of my tongue, but I can't remember it. I hope this has given you a little bit more information than some of the stuff that's in your textbook. The textbook, this is the first time I've used this textbook for this course. I do believe it's a little bit more comprehensive, contains a little bit more in-depth information than the last textbook that we used. I'd be interested in your opinions on the textbook. That's about it for right now. Do consider choosing the topic for that 10-page paper that is going to be a significant part of the evaluation in this course. Look at the topics in the assignment section of Sakai, choose one, and begin to gather your research and begin composing. I think it'd be a good thing for you to do that. Uh, don't hesitate to email me or call me, stop by the school on an evening when I'm there teaching or during the day, and I'd be happy to sit down and talk with you. So, um, y'all take care. This is Dr. John signing off. Bye.